Morning.
How are you? Good.
All right. And we're just going to go around the room real quick, and we're going to state our name, what worksite we're from. Go from there. So I'll go first. Angie Brass from Partners for a Healthier Community. Over to Josh Clare and Jason Kohlberg from PT Health and Safety Solutions. They're just going to talk briefly about their organization and what they do here in the city. So
I'm going to
welcome.
stand over here just so I
Yeah.
don't like back check. So if there's any questions, just interrupt, and that's fine. So one of the things that we were going to talk about last couple of months with Angie, we've been wanting to present and saying, what do you want us to present on? We have information on just about everything under the sun. What do you want to present on it? Her question was, well, what do you do? And so the answer is yes. We do everything under the sun that has to do with injury prevention and worksite wellness. We will try to be a full service provider for anything to do with starting a wellness program or enhancing one. Any other questions, ideas, comments?
Have you tried different things in like the banking industry or that have been successful? Or?
We haven't done anything recently,
Yeah.
but I know it's a concern of mine, and I've heard from a couple of other employees that they have a bit of a concern about how they are working and how they're feeling.
Yeah.
So I would like to do something.
And I think one of the things that, like I said, we tried to make this a full service type thing. So as clinicians, we've gone to the next step is that we can also do like a health fair type environment. We have a certified clinic now to do finger stick blood testing for cholesterol, blood.
I think that they're still doing some community screenings, but they're not doing the worksite.
They do. They have the van, but the van's pretty booked up, and then there's a correlation with the blood and all that. But unfortunately, they're not funded anymore. But we have other resources, so that's always a good thing.
What areas do you guys work in? Like, is it just Fall River or?
We look at, we're kind of in Bristol and Plymouth County. You know, that's kind of our radius that we like right now as far as travel. Going outside of that, we would have to establish probably a secondary location just to accommodate.
Your clinic is in?
It's in Fall River. It's based in Fall River right now. Yeah. You have like a Taunton branch, or you can have different divisions.
Adds that social
But you can disseminate healthy information to all of them. You can pair with a number of health trackers, so the Fitbit to, they can go on and say they don't have one at all, they can go online and say, you know, I'm not a walker, I'm a bike rider. All right, well you just did a 30-mile bike ride today, go in line every day and say, I did my 30-mile bike, it converts it to
There are
steps.
maps we created.
So they can still kind of
one bank.
This has a built-in system where you can do some incentivized activities, and it's just a matter of the administrator kind of keeping track of those kind of
download all the
milestones.
And if they have
because you can give points. If you say your business, you have a mandatory, it's coming July 1, and you need everybody to do their,
But you can also
update their health insurance information, and it's time for, I forget, open enrollment's back up
so
again.
it's not just walking.
If they need all of that done, and you need it by a certain time, you can develop like a survey link or something that says when you're done completing the survey, you're going to get some extra points. And so you can incentivize your process to make it speed it up
There's a
because they
couple
can
of,
earn
once
points.
you get started with it, there's
What
a
do they
couple
get
of
for the
hiccups
points?
every now and again, just
That's kind of
knowing where the buttons are, but it's
It's
fairly
like, what do
easy
they want?
once you get.
We try to say,
It's called
give them something
Healthy
healthy.
That's what we call it, yeah.
Yeah, like Stop and
We
Shop
try-
gift
it's
card, let them go
education.
buy some,
That's where we
incentivize
really
them
try
to give
to,
them groceries or something.
incorporate with it.
I like
And
the
then
ideas now
actually,
during the summer of
if
like,
you go,
can the company
to our
say, you
library,
know what, we're gonna go to
there's a bunch of
Silver
different-
Farms and
we're
as
still
a
kind of
business,
filling
we're
it,
gonna buy
but just a
10
bunch of
shares
information that we
of fruits and vegetables.
try
And
to
of
come
those
across
10,
and try to add.
each